Talking about the anterior and medial aspect of the thigh, in order to understand the anatomy of the thigh, it is very important to understand the underlying bony structures and the bony landmarks in that region. Moreover, it is also important to understand the surface anatomy because that is the thing that we actually look at the most when assessing our patients clinically, because we'll start off with the surface anatomy. So in this section, we're going to talk about the bony landmarks and the bones which are actually important and are actually present underneath the area, which is the anterior and medial aspect of the thigh, which includes the innominate bones, including ilium, ischium, and pubis, and as well as the femur. We're also going to talk about the surface anatomy as well as the Q angle, which is very important clinically as well as biomechanically in terms of whenever we are discussing the anterolateral or anteromedial aspect of the thigh. So starting off from the pelvis, because the thigh extends from the pelvis to the knee, and this is where we have two innominate bones on both sides which are joined together posteriorly by the sacrum, whereas they are anteriorly joined by the you can call it as the symphysis pubis, and that is because of this articular or cartilaginous disc between the two pubic bones. Now, sacrum is actually a part of the spine, which is then continued in the form of the coccyx, also known as the tailbone, whereas the hip bone, also known as the innominate bone, they are actually two separate bones. This is the on one side and this is on another side, but they are not an individual bones. For example, if you talk about one innominate bone, they are actually composed of three individual bones which have been fused together to form a single innominate bone. So if you talk about one innominate bone, so we have the ilium, which is on the superior aspect, the ischium, which is on the posterior aspect or posterior inferior aspect, and the pubis, which is on the anterior inferior aspect. So if you look from the front, this is the anterior view. So this is the ilium, this is the pubis, and we have the ischium on the posterior aspect. So to take a better look at the ischium, we will take a look at the lateral and the medial view of the innominate bone or the pelvic bone. So here we have a picture. So first of all, one important thing that we need to identify whenever we are taking a look at the ilium, we need to idealize, or we need to confirm that it is the medial or the lateral aspect. So if we talk about this one, so this is actually the lateral aspect. So lateral aspect because we have the acetabulum visible from this side. So acetabulum is on the lateral aspect of the you can call the innominate bone. So if the acetabulum is here, so it means that it is the innominate bone of the right side. So let's take a look at some important structures. So as you can see that this superior part of the innominate bone is the ilium, this posterior and inferior part is the ischium, and this anterior inferior part is the pubis. So if you talk about the ilium, we have the anterior inferior iliac spine and then the anterior superior iliac spine, and this anterior superior iliac spine is very easily palpable if we actually try to palpate the anterior aspect of our pelvis, and this then extends towards the posterior superior iliac spine, and this area in between the anterior superior iliac spine and the posterior superior iliac spine is iliac crest, which is also very easily palpable. Now, just beneath the posterior iliac spine, we have the posterior superior iliac spine, we have the posterior inferior iliac spine, and beneath the posterior inferior iliac spine and superior to the ischial spine, in between these two spines, we have the greater sciatic notch. One important thing to notice in this picture is that posterior inferior iliac spine is a part of the ilium, whereas the ischial spine is a part of the ischium. So moving on to ischium, we can see that we have the ischial spine, and just beneath it we have the lesser sciatic notch. So ischial spine is actually that bony landmark which actually demarcates the greater sciatic notch and the lesser sciatic notch. So the notch superior to the ischial spine is the greater sciatic notch, and inferior to it is the lesser sciatic notch. Just beneath the lesser sciatic notch we have the body of the ischium, and then we have the ischial tuberosity. This is a special bony landmark because this is the place on which we sit. When we are sitting, our weight is actually being transferred to the seat or the chair via the ischial tuberosity, and this is the ramus of the ischium. On the other hand, if we talk about the anterior aspect, we have the pubis, and just like the ischium, it also has the rami, but it has two rami instead of one ramus, which is in the case of the ischium. So pubis has the superior rami as well as the inferior rami. The inferior ramus of the pubis articulates or is joined with the ramus of the ischium, and then we have the superior ramus, and we can see that acetabulum is actually not formed by the single bone, but acetabulum is actually formed by the combination of all three bones, and this is where we get our hip joint, which is actually formed by the acetabulum and the femoral head. Now here, if you take a look at this picture, we do not have any acetabulum visible in this picture. So we can say that this is the medial aspect of the innominate bone. And here we can see that there we have the ilium once again. And we have the same anterior iliac, superior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine, and the anterior inferior iliac spine. But here we have the iliac fossa. So iliac fossa is on the medial aspect of the ilium. And once again, we have the iliac crest as well. Now, if we come lower down, we have once again the ischium and once again the ischial spine, which is demarcating the greater sciatic notch and the lesser sciatic notch. And once again, we can see the body of the ischium and the ischial tuberosity on which we sit. And this actually circle here is actually the obturator foramen, and which is visible from both medial and lateral aspect. And once again, we have the ramus of the ischium, and once again the two rami of the pubis as well, which is located anteriorly. And here we have the pubic tubercle, and this once again is the body of the pubis, the superior ramus and inferior ramus, and this is the whole of the pubis. So that's pretty much about the innominate bone. So let's take a look at the other bone that we have in the thigh or the anterior medial thigh region, and that is the femur. So femur extends superiorly and forms the hip joint, and extends inferiorly and forms the knee joint, and it is one perhaps one of the largest bones in our body. And if we take a look here, so if we want to identify the side, so let's suppose if I'm talking about this bone here, so here we have, this is if we can see these lateral condyles here, and if we can see this area here, so this area actually shows that this is actually the anterior aspect, because this is the part where the patella actually articulates with the inferior aspect of the femur, forming the patellofemoral joint. So this is the anterior aspect, and this is the posterior aspect. Now, talking about the posterior aspect, if we take a look at the head of the femur, so this designates the medial aspect of the femur. So if we take a look at this one, so here we can say that this is actually the right femur, because here we have the pelvis in this area, and it is articulating with that. So this is the anterior and posterior aspect of the right femur. So that's how we can demarcate the anterior and the posterior aspect, as well as the medial and lateral aspect of the femur, as well as the side demarcation, that if it is the left or the right side femur. So let's start off with the bony landmarks proximally. So here we have the femoral head, which articulates with the acetabulum to form the hip joint, and here we have the fovea capitis, where we have the ligament of the head of the femur, which attaches here. And this here is the neck of the femur, and this here is the greater trochanter on the lateral aspect, and the medial trochanter on the, or the lesser trochanter on the medial aspect. Now, the lesser trochanter and the greater trochanter actually joined by the intertrochanteric line. And if we look at the anterior aspect, we can see that there is no linea aspera on the anterior aspect, but there is a sharp line which is known as the linea aspera on the posterior aspect of the shaft of the femur. Now, coming on the inferior aspect, we have the adductor tubercle, which actually serves as the attachment site for the adductor muscles, are located on the inferior aspect on the medial side. And we have the medial condyle and the lateral condyle, which actually articulates with the tibia to form the knee joint. And just above the medial and lateral condyles, we have the medial epicondyle and the lateral epicondyle. And as already mentioned, on the distal antero aspect of the femur, it is an important structure and important site, because here is the place where the patella articulates with the inferior aspect of the femur, forming the patellofemoral joint. Now, another important structure, Q angle, because when we talk about thigh, we need to talk about the Q angle, and that is why, to understand the Q angle, we needed to talk briefly about the bony structures which are present here. So Q angle, or so known as the patellofemoral angle, is the angle between the rectus femoris and the patellar tendon. So rectus femoris is actually one of the muscles, or you can say the superficial part of the quadriceps femoris, and it is one of the four muscles which make up the quadriceps femoris. And the patellar tendon is actually this is the insertion of the quadriceps or the rectus femoris via the patella into the tibial tuberosity. So this actually part is known as the patellar tendon. So if we take a look, the line of action of the quadriceps is actually at an angle, whereas the patella is pretty much perpendicular to the ground. So they make an angle with each other. So this angle actually ranges from 13 to 18 degrees during knee extension, and it is greater in females as compared to males, because females have a wider pelvis, also known as the gynecoid pelvis, as compared to males who have an android pelvis, which is narrow. And knee and the problems such as patellofemoral joint dysfunction and patellofemoral pain syndrome can actually arise due to an increase or decrease or abnormal Q angle. So how to measure a Q angle? So first of all, we need to draw a line from the anterior superior iliac spine and the tuberosity, which is located here, and join the anterior superior iliac spine with the tibial tuberosity to the so drawing a line from the anterior superior iliac spine to the patellar midpoint, and once again drawing a line from the tibial tuberosity to the patellar midpoint. So we have two lines here. One is this from the tibial tuberosity to midpoint of the patella, and one is from the anterior superior spine to the midpoint of the patella. One another important thing to understand is that we are talking about rectus femoris, but rectus femoris does not arise from the anterior superior spine, but it arises from the anterior inferior spine. So why are we taking anterior superior spine for the calculation of Q angle? This is because of the reason because anterior superior spine is more easier, in fact very easy to palpate. So that is why we are talking about anterior superior spine instead of anterior inferior spine. So when we join these two lines, one is the tibial tuberosity to the midpoint of the patella, and we extend it, and then we join the anterior superior spine with the midpoint of the patella, and the point of intersection is known as the Q angle, as we already discussed. Now, talking about the anatomy of the anterior-medial thigh, it is also very important to identify the structures that we can actually see superficially in our patients or individuals, and that actually designates as the surface anatomy. So if we talk about here, so here we have the proximal aspect, and here we have a muscle which is actually the sartorius, and it comes from the lateral aspect and moves towards the medial aspect. So that is why it actually also can be counted as a muscle of the anterior thigh, and also because of the as a muscle of the medial thigh, because it starts from here and then moves towards here and inserts here. So that is why it is present anteriorly as well as medially. Now talking about the rectus femoris, it is actually the superficial most part of the four muscles of the quadriceps femoris. So this is actually the rectus femoris, which actually arises from the anterior inferior spine and inserts into the tibial tuberosity via the patellar ligament, and it is the primary knee extensor. And we can also see the patellar ligament just beneath the patella here. So patella is this bone, a sesamoid bone, which is present just above the distal aspect of the femur. Other muscles here, we can actually look at the vastus lateralis, which is actually also a part of the quadriceps femoris, which is located on the lateral aspect, and vastus medialis, which is another part of the quadriceps femoris. Here we can also see the adductor magnus, more remarkably here, which is one of the medially located muscles, and perhaps the largest of the adductor muscles. And these are all the structures you can easily palpate and identify and observe in the surface anatomy of any individual. So that was all about the first section. I hope you learned something new out of it. Keep on watching sqadia.com for more lectures like this. Thank you very much.